Hello, everyone, and welcome to the IMA Weekly Show. I'm Dr. Ryan Cole, Head of Medical and Scientific Affairs at the Independent Medical Alliance and Senior Fellow in Pathology. Tonight, we're talking about something very important. We're talking about medical courage. What does it cost a doctor to speak honestly, to treat patients according to clinical judgment and stand by what they believe is right? Obviously, over the past several years, many physicians have faced public attacks, investigations, licensing pressure, and legal threats for asking questions, treating patients or challenging, quote, official narratives. And, as human beings, as patients, that should concern all of us. Medicine, should be guided by evidence as well as informed consent, and especially the doctor-patient relationship. But when fear and politics or bureaucracy takes over, the patient loses. So tonight we're joined by two physicians who understand this issue very personally, as well do I. Dr. Mary Talley Bowden has been a strong voice for physician autonomy, informed consent, and health freedom. And she's also a senior fellow with the IMA in otolaryngology as well as sleep medicine. And we're also joined tonight by Dr. Ron Elfenbein, an emergency physician who provided testing, treatment, monoclonal antibody therapy during COVID. And his legal case raises serious questions about due process, physician autonomy, what happens when doctors speak publicly about government health policy. And tonight's question is very simple. What kind of medical system do we want? So, one where doctors are afraid to speak, or do we want one where doctors are free to tell the truth, use their judgment, and put patients first? So, Dr. Bowden, I'm going to start with you. If you don't know Mary, she's an excellent physician and a very strong voice for medical freedom. She's a board-certified otolaryngologist, sleep medicine physician. She completed her residency at Stanford and has treated sinus, sleep, and allergy disorders both in adults and children. She founded Breathe MD in Houston with a focus on transparent pricing, patient-centered care, and a simpler healthcare experience. She also founded the Coalition for Health Freedom, which brings together health organizations across the country to advocate for medical freedom and patient rights. And she just released her new book titled Dangerous Misinformation, The Virus, the Treatments, and the Lies, which we'll be getting into tonight as well. So Mary, welcome. It's always good to have you with us.
It's great to see you, Ryan. Thanks for having me.
Thank you. And Dr. Elfenbein, we're honored to have you and welcome to you as well.
Thank you so much for having me.
You bet. And Dr. Elfenbein, for those of you that don't know him or haven't heard his story yet, he's an emergency physician who trained at Johns Hopkins Hospital, where he served as chief resident. His work has included emergency medicine, urgent care, EMS medical direction, public health response, and COVID care. And during the pandemic, his urgent care became one of Maryland's busiest COVID care sites. He provided testing, treatment, monoclonal antibody therapy at a time when many patients were looking for help. So again, thank you for all of that. All right, let's dive into this. So I'm going to start with Mary. And when you hear the phrase, the price of medical courage, what does that mean to you after everything you've been through at this point?
It's very expensive.
Right?
It's not cheap.
Yeah.
And it's not just financially expensive, but it has been very meaningful. I told one of my kids the other day, I'm actually really glad this all happened because it gave me purpose. Life has not been it's been far from boring the last 6 years. And I don't, I didn't feel like I had a really choice. I was sort of thrust into it. I mean, my crime was tweeting vaccine mandates are wrong on Twitter. I mean, and back then I'd get one like, it wasn't like I had any kind of following. So I don't really know that I was that courageous, but they made me so mad that I just decided to fight back really hard. And I'm just not going to give up until I win, period.
100%. And, where do you think the medical system went wrong in how they treated doctors, who asked questions or just simply wanted to practice differently?
Well, the public health system took over, and then we had bureaucrats, dictating patient care from the safety of their bedrooms over Zoom calls and completely annihilating people like us that were, I mean, firsthand experience is everything. I mean, as well as I do, there's a study that can support any argument you want in medicine, right? That's what I learned in residency. You go to Journal Club and every article you tear apart because, not enough power or conflicts of interest or so I finished residency with a deep skepticism of published research as a starting point. But what you really rely on is your day-to-day vast experience. You rely on the people teaching you more than anything. And it's 70% of published studies nowadays are funded by big pharma. And the other 30% are funded by attendings who are just trying to get their tenureship, right? They're just publishing so you don't perish. It was very frustrating. I mean, I treated over 6,000 COVID patients during the pandemic. I've never treated that many patients with the same disease in my career, and I never will again. It's unheard of. And you quickly become an expert, and we were completely ignored.
Yeah. And I mean, that's such a good point. All of us that are, speaking and joining each other tonight, we have the feet on the street, firsthand experience, face to face with patients, and we were being dictated to by people that never saw a patient. And so, I mean, that's quite the difference. Now, Ron, you have an interesting story, and a lot of people may not know about your legal case or what you've gone through. So let's kind of set the framework, help people understand, what you were doing. Take us back to that early COVID period, what you were, busy doing, seeing on the ground, what your experience was.
Yeah. So thanks for asking. And like Mary said, I mean, I was strapping an N95 mask to my face every single day. I had the red marks, for weeks that they wouldn't go away. I wasn't hiding in my basement. I wasn't, going on Zoom calls. I was on the ground dealing with this stuff on a daily basis, look, we didn't know at the time. We were all worried. I felt like I was putting my life on the line and I was going to come home and potentially infect one of my children. I have 4 kids and maybe kill them. I mean, that was a horrible scenario. We all lived through it. So it's hard to remember, but we got to go back and think about that. So I owned an urgent care center. I was working mostly in the emergency rooms at the time, but I had this urgent care center and I could see what was coming because it was pretty obvious what was based on what was going on in China. So I started to prepare and purchase PPE and stuff like that. And because of that, we positioned ourselves to become really the largest testing site in the area and then pretty much throughout the state of Maryland. And then monoclonal antibodies became a thing. And I've always been a proponent of that technology, which has been around since the 70s, by the way. This is nothing new. And I saw how efficacious those things were. So I said, I put in an application for the state of Maryland. I said, I'd like to open up an infusion center. I knew nothing about infusing anybody. Like I mean, I'm an ER doctor. You get shot, you get stabbed. I'm your guy. But like how to infuse you, I don't know. So I had to teach myself all of this stuff, everything. What
Sure.
IV pumps, what IV tubing, what kind of filters you need. I mean, all the stuff I just had to dive into the literature and really teach myself. And we very quickly became the largest supplier in the entire state of Maryland of monoclonal antibodies because the government made it so onerous and difficult for people to get this life-saving medication. I couldn't understand it. I could not wrap my head around it. I said, what is going on here? I have this great medicine. Nobody can get it. Why are they making it so difficult for people to go out and get it? So we made it easy. And we ended up infusing well over 5,000 people throughout the entirety of the pandemic. And we tested over 300,000 people. So we were really busy. And this stuff was wonderful. And then they really started to politicize it. They said first, well, we're gonna control the distribution. The federal government, I mean, they came in and said we're gonna take over how this is going to be distributed. And literally overnight, that led to artificial shortages. So you'd ask for 100 doses, you'd get 60 doses or something like that. And then a couple of months later, a couple of weeks later, they roll out this equity initiative, and they said, well, we're not gonna we're going to determine where it goes based on equity, which I still have not gotten a good definition for that term. I don't understand what it means. And it certainly has no place in a discussion about medicine. And but that's what they did. And states like Florida got basically cut off. And Florida was a tough one because that has the highest median age of any state in the union. And all those patients, a lot of comorbidities, they're the highest risk population. And there was a Delta surge at the time. This was in late 2020 and late 2021, excuse me. And they basically cut Florida off. So DeSantis, the governor, had to go out and purchase monoclonals with taxpayer dollars directly from the manufacturers. And then the Fed stepped in and said, well, you can't do that. And he did it anyway. And even though the Feds had ample supply, they wouldn't give it to states like Florida. And it just so happened that most of those states were red, that were not getting supplied.
And what were you seeing in terms of the effect of those for patients?
I mean, it was like a godsend. I've never seen anything like the efficacy of that medication in anything I've ever dealt with in my entire career in medicine. I mean, the number needed to treat is so low on that, on with those monoclonals at the time that, I mean, for every 10 people you treated, you saved one life essentially,
Mhm.
or one hospitalization. I mean, it's unbelievable how efficacious that stuff was and that medicine was in medical terms. And again, never had an experience like it in my life. And I would have built 50 centers if I could have, but I couldn't find the staff and I couldn't find the facilities. And so actually the federal government at one point approached me and said, could you open up a site for us at FedEx Field where the Redskins play football? So we did, in partnership with HHS, the Health and Human Services, and the Maryland Department of Health. We opened up a site and I ran it, and it was great. And we were saving people's lives, but then they politicized it. And then in late 2021, they, based on completely spurious data, they shut the whole program down nationwide. They said, oh, well, the Omicron surge is coming and it's reached a 70% prevalence. So we're just going to shut the program down. And I was so angry. I went on Fox News and I went on Newsmax and I went on a bunch of other right-leaning news entities. And I said, they're going to kill people. They don't know what they're doing. They can't read the data. And it turns out I was right, because about a month later, the federal government said, oh, we misread the data. The prevalence of Omicron wasn't 70%, it was 20%. Let that sink in, right? I mean, how does someone make a mistake like that? And the magnitude of that mistake is enormous, because basically by shutting the program down, they were consigning people to die. Like, there's no question about it. A certain percentage of those people that tested positive are dead or needed to be hospitalized because of that. And that is just unconscionable. So I was really mad and I let him have it. And you talk about medical courage. I don't know that I was being courageous at the time. I think it was just I was angry, and I still am. And the bureaucratic arrogance that these people had to say we know better than everybody else, and we're gonna make this decision for every doctor and every provider out there. And then 4 months later, I get indicted on healthcare fraud charges with no investigation really having been done. They got my name wrong on all the charging documents. They never talked to my partners. Like, all these things that, like, I'm not Sherlock Holmes, but I would think that as an investigation, any reasonable human being would have done. They didn't do any of it. Even the chief judge of Maryland, who was adjudicating my case, called out the prosecution in a pretrial conference and said, this case is a case of, quote, shoot first and ask questions later, because that's exactly what it was. That was the judge. He said that.
Wow.
Yeah, it's
Yeah,
crazy.
and so, really, how did that all develop? I mean, you're trying to save lives, you're doing so, you're very busy, we all know how running a busy practice is, and they come at you for a bunch of charges that are spurious over a couple of most people that don't know this case, it was, at the end of the day, it was over a couple of $100 of billing discrepancy supposedly. And how did it, what was the guidance? I mean, here we are in the middle of a pandemic, you're doing yeoman's work, and what were the billing rules, the clearance, the guidance, clinics trying to interpret
Zero.
new, yeah, zero, exactly. And changing the rules in real time, basically.
Yeah. And again, this whole, it was ostensibly billing dispute, and they think that, oh, well, you were upcharging, upcoding. But if you really think that that was the case, like, what would a normal human being do? If you think you're being overcharged for something, you'd pick up the phone and you'd call and say, could you explain your billing practices? We don't understand this. They never did that. They never asked for any explanation, despite the fact that we had very reasonable explanations. They never called, they never sent a letter, they never sent an email, they never sent a fax. I mean, there's a billion different ways you can communicate with someone. They didn't use any of them. And just to put it into perspective, we saw in that time frame of the indictment over 100,000 people. They picked five. And I just want to emphasize that, typical healthcare fraud is billing for things that don't exist, right? These are
Right.
the charts of the five patients.
Sure.
They're real human beings. The government called three of them at trial. I don't know why, but they did. And the people testified and said, "Oh yeah, I got seen. I'm a real person. They tested me. I got seen." Like, where's the fraud?
Right. Meanwhile, doctors, and there's a doctor in California that just got charged on $45 million of false Medicare billing, that kind of stuff. And those who, spoke out because we didn't like how government policy was working, we became targets of a system, and you obviously became a target of the system. So, to hear that word, quote, fraud, you know, most people don't understand medical billing and the complexity and coding and whatnot. And then you get labeled with something that obviously has a very not fun connotation to it. How did you take it when that hit, and what was the biggest problem, that came from that?
Oh, I mean, so we had eight sites. So we went from, you say running a busy practice. I was running eight busy practices because we went from one site to eight of them within, 8 months, 10 months, because it was such a demand. So we had 300 employees. I mean, it was all, the government basically took it all.
Sure.
It's devastating. I mean, just imagine your name, the United States of America versus you. Like,
Mhm.
and they come at you with this sledgehammer, and every piece of paper you get from them with the discovery has this, seal of some three-letter agency on it that scares the crap out of you. So it is the scariest and the most difficult place to be put in, and they know that, and they use that, and they leverage that to try to get you to plea and to get you to, call them and say, oh, I want, have some mercy on me and blah blah blah. But I didn't do anything wrong, so I wasn't going to do that.
Sure.
But I mean, I will tell you, I didn't sleep for 2.5 years. I lost weight. I was a shell of my former self. It was horrific for myself, my four children, and my wife. It was devastating is the best word I can come up with. It was horrific.
Yeah, and I think that's the part most people don't see. I mean, behind the scenes, I know, Mary, you have four kids, right?
Mhm.
And you have four kids. I have six kids. I had 80 employees at the time. You had, 300. They think, haha, we're going to get this doctor that's speaking against our narrative. But at the end of the day, they're not just affecting your physical health and stress levels. They're affecting your family. They're affecting your employees and their families, et cetera, et cetera, all for something that ends up being exceedingly picayune and irrelevant. And so you went through, literal hell for a couple of years and had to kind of bite your tongue under advice of your attorneys. And thankfully, your story is coming out now because, we're just a small sample of so many other physicians that haven't had the opportunity to tell their stories. So kind of go to the court process and what ended up happening there. And, I think what the audience needs to understand is what the judge ended up saying about the case, the jury verdict, et cetera.
Yeah. So, they charged me with this quote unquote crime that just didn't make any sense to me. It was basically upcoding, picking the wrong code. Now, there's over 69,000 codes in ICD-10, and
Yeah.
they came after me for saying, well, you picked the wrong one in a pandemic. Like, seriously, like, that's what you're coming after me for? And they at trial, no exaggeration, they never said why what we did was wrong. They never said how what we did was wrong, and they never said what the appropriate code should have been. They just kept pointing their finger at me and saying he's a criminal and he's wrong. And I go back to these five charts because, you know there are professional billers and coders that do this for a living, right? The government didn't even go to the trouble of hiring one of those people to look through these charts. They just had government lawyers look through them. Now, what does a government lawyer know about coding and billing? Zero. But that's what they did. They never even went to the trouble of and the expense of hiring someone. So I did. I hired a guy who was the past president of the American Association of Professional Coders, and he went through hundreds of charts. The government looked at five. He went through hundreds of the charts and said they were all appropriately billed. And by the way, I didn't see any of these people. I was the medical director, so I didn't even code them, build them, see them, touch them. And then we had a third-party billing company also. Like, I'm like, this is just. So we get to trial, and their only expert that they called was an expert on Medicare, didn't know anything about coding, and my lawyers completely eviscerated him on cross-examination to the point where the judge dismissed him and said, "Could you please wait outside?" Dismissed the jury, called us up to the bench. This is day one of trial. Starts wagging his finger at the government and says, "Where is the crime? What the hell are you doing here?" Day one. And the government, "Oh, you'll see, judge, it's coming, it's coming." And he's, "Well, you better show me something." And anyway, long story short, we go to the last day of trial. The Every one of their theories got shot down. It was we weren't spending enough time with our patients. That same guy I was just referencing on cross-examination admitted that time is irrelevant. So there went that part. They indicted me based on that, but so they called me a criminal because of that. But he testified at trial that wasn't relevant, in direct opposition to the indictment. And then they said, "Oh, none of this was medically necessary." He testified that it was medically necessary, in direct opposition to what they indicted me for. Of course, this was medically necessary. So at the end, they had nothing left. So the last day of closing arguments, they said, "Well, jury, you may be asking yourself what the appropriate coding level was. Should it have been a level 4, a level 3, a level 2? It doesn't matter. You don't need to know. You just need to know that he's a criminal and he's wrong." And then they said, the defense had this expert testify, and they showed all these charts, and they went through all these rules and regulations. And does it make common sense to you? Use your common sense, jurors. Like, does this make common sense? And you know what? He's right. None of this makes common sense. But the government is the one that put these rules out, and now they're saying, don't use just use your common sense. Forget the rules that we are the ones that put in place. Like, it's just mind-boggling. And I think the jury bought it because technically the lawyer was right. It doesn't make common sense. It's absolutely crazy. But just imagine calling the IRS and saying, I used my common sense on my taxes this year. Is that okay? Like, it's just a ridiculous argument, but that's what he said. And I think the jury bought it, so they ended up convicting me. But the judge, thank God, was paying attention, and he issued this 93-page opinion, which I carry with me all the time, completely eviscerating their case. And he said, like, the government did not carry its burden, and no reasonable jury could have so concluded. The evidence weighs so heavily in favor of the defendant that it would be unjust to enter judgment against him. 93 pages of that. And then not only did he acquit me of all charges and said, you're innocent, but he granted me a new trial in case the government appealed. And literally, like, weeks before Trump's about to be inaugurated, they appeal it. So now I'm facing a new trial, a second criminal trial, to go through this hell yet again.
Wow.
And the AMA, I'm not a member of the AMA, but the AMA came to my defense and wrote a friend of the court brief. And what's really remarkable about that is the AMA puts out the ICD-10 and the CPT manual. So they write the rules that the government is accusing me of breaking, and they said he didn't break the rules. So the writer of the rules is saying he didn't break the rules, but the government is still accusing me of breaking these rules. You can't make this stuff up. It's crazy.
And that's what's amazing. Both the American Association of Physicians and Surgeons as well as AMA, they came and both wrote front of the court briefs on your behalf. And so, here you are facing the government again. And
it's 50 years in jail, by the way. 50.
I think that's what people need to understand. This isn't just oh gosh, here's a dispute between a couple of codes and whatnot. It's 50 years in prison that Dr. Elfenbein's facing for something that a judge already looked at the case and said, this is absurd. Of course, Dr. Elfenbein was correct. So, hey, Mary, I'm going to pull you in here. When you hear Ron's story, Dr. Elfenbein's story, what concerns you most as a physician today? When you hear what he's gone through, you've gone through a lot, I've gone through a lot, but man, what he's gone through, it's beyond.
I think it's a lesson that you don't do business with the government. They are not good business partners, right? It is a horrible business partnership. And that's why I've completely opted out of that system. I do not contract with the government. It's just terrifying what they're doing to you. It could happen to anybody.
Yes. Yes,
Yeah,
it can.
I
And
think that's the important point is, if we're so busy, we went into medicine to care for patients, and then the system has been built around us. And well, you didn't read code section 3.910, blah, 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 and all these complexities that, over the years, layer upon layer upon layer. And then you don't jump through one hoop or cross one T right, and all of a sudden you're a common criminal. When at the beginning of the day and the end of the day, all you were doing was trying to save a life. And
and and I just you touched on this before. I don't mean, I'm sorry, I just wanted to
you're
jump
fine.
in.
No,
You
jump
touched on
right
this,
in.
Ryan, before. Even crazier, okay, is we were billing, again, it doesn't really matter, but we were billing what's called the level 4 for evaluation and management codes. And we had perfectly reasonable rationale for doing that. But the government said that was wrong. Okay. So the next lowest level is called the level 3. And the
Mhm.
average difference between those two is $50. Okay. I Googled it. So it's $50. And I say average because every insurance company pays different. So the average is about 50. 50 times 5 is $250. So the United States government, under the Biden administration, said Dr. Elfenbein essentially stole $250 because we don't agree with how he billed. We are going to throw him in jail for 50 years because he took $250. Like, I can't make it any simpler than that. Like, in what galaxy, universe, world does that make any sense to anybody? Like, it is just mind-bogglingly silly and stupid and crazy, and it just needs to go away. And I'm trying desperately to find somebody in the Trump administration because they were smart. The former administration, they started this process again right before they left office, and the snowball's kind of rolling down the hill, and you got to find someone who's courageous enough to stop the snowball. And I'm trying to get in touch with somebody that can do that, and that person I think would be acting Attorney General Blanche,
Mhm.
um, or the president himself. But it's because he benefited from monoclonal antibodies. I mean, he was one of the first people in the nation to get monoclonal antibodies, and it saved his life.
Yeah, and let's hope, as this broadcast and after we do the redrop of this show tonight, folks, make sure you share it on X, and maybe it will bounce on some of those ears that need to hear it, because this is such an important case of government overreach. And to think that our tax dollars are being spent prosecuting someone who was literally saving thousands of lives, it really, gosh, if you don't have a heart for what Dr. Elfenbein's gone through, this is just it speaks to the fact that there are things that just absolutely need to be corrected in our system. And what are some of those things? How do you think the system could work better, or what do you think could be corrected or better understood after this awful experience that you've had to go through?
Oh, the list is very long.
Right.
I think I firmly believe. Well, yeah, okay, my story's sad. It's terrible, and I'm not going to downplay that at all. It is, and it's awful. But to Mary's point, like, this could be anybody, right? They could do this to anybody and any doctor for any reason at any point in time. It doesn't have to be. You don't have to be a physician. You can be anybody. They can come after you for whatever reason they want. Uh, and that should terrify you, because this is life changing. This is like life ruining. And um, as a physician, the next time there's a pandemic, because we all know there will be another one, whether it's man-made, whether it's a hoax, whether it's real, whatever, there will be another one. You want your doctor to step up and to question the narrative and to say, this doesn't make sense. I don't understand what's going on. Not just to shut up and be compliant, but to say, I don't think this is right, and here's why. And to go out there and take the risk and put the mask on and put the booties on and put the gloves on and go out there and see the patients. But you know what? Why would anybody put themselves in that position? So
Great,
I
great
think that it's
point.
broader than me. It's like, this is going to be the next time. Why would anybody go through what I'm going through? Like, you'd be an idiot to do that. So people would say, well, screw that. I'm sitting this one out.
And kind of to that bigger picture now, and to, beyond just the case, but to those future scenarios, you know, again, going back to the point of patient-focused medicine, why we care as being physicians and practicing how we have, how do physicians protect themselves in the future? Or what do you say to future physicians who, you know, want to practice with integrity? I mean, where does that put us as a profession?
You asking me or Mary? Sorry.
Both of you, either of you.
Oh,
I mean,
opt out.
Mary, you want
Don't.
Yeah, opt out, says Mary.
I don't, every man for himself, go independent. I mean, there's no, what they did to you, Ron, is just unbelievable. And it's a lesson. I mean, I don't, no one teaches you this when you go through your training either. You just,
no,
oh, well, I'll sign up for Medicare, no problem. You have no idea. I mean, I'm sure you've never even imagined anything like this would happen to you.
no, not in
But
a million years.
the lesson is you don't contract with the government, period. I mean, opt out.
And unfortunately, the message too is don't speak out. Don't say anything when something doesn't look right. Don't say anything. And that's a terrible message. We should have the exact opposite message. It should be, the definition of science is questioning everything and not taking anything for granted, right? And researching everything and saying, I don't agree with this. I'm not sure, so I'm going to study it and I'm going to look at it. But this is so antithetical to science, what they're doing. And it's so un-American too. I mean, I think we pride ourselves in this country on due process, on doing the right thing. And this is exactly the opposite of that. So I don't know the answers. How do people protect themselves other than, as Mary said, don't take med. One of my best friends is a plastic surgeon, and he's in Connecticut, and he used to take Medicare. And he said, I lose money on every Medicare patient I see, but I feel badly for these people and I want to help them. So I will take little old ladies and little old guys and help them and make them better. And as soon as I got charged, he's like, screw that. I'm never touching this again. And you know who got hurt by that? All those patients that now have no place to go. So this ends up
100%.
hurting the people it's supposed to be helping, which is just
100%.
crazy.
Yeah. And I think, that's kind of one of the challenges is there are so many people out there in need, and supposedly there's this system to help them, but then if you, again, to your point, if you speak out, become that tall blade of grass, obviously you get cut, and it really ruins the opportunity for people to get care. And
Yes.
that's not why any of us went into medicine. So, I mean, what can patients do to support physicians who are, willing to practice independently? What's your advice, to patients after what you've gone through as a physician who only wanted to help them?
I think patients need to be vocal. And so we support our doctors. We support the people that we like. We support, like not every doctor is a good doctor, and you don't have to support every doctor, but the idea is just support the community in general, because people don't go into this. They don't go through what Mary and I and you went through, all those years of training in medical school and not sleeping and, because we just want to, be bad people or make a lot of money. We do it because we really care and we want to help people. I would say 99% of us do that. I think that that's a fair thing to say. So I think patients can help us by speaking out and saying, we support these doctors. And look, thank God for the IMA and AAPS, like you said, because the other thing is organized medicine, and I don't mean to pick on anybody in particular, but organized medicine in general is the worst. And I just, with the exception of the few organizations I just named, they don't support anybody. They're out there for themselves. They don't really have anything to do that really helps. And I I am a member of the Medical Society of my state, and I do support them, and they've been great. But in general, just most of these societies are not worth the paper they're printed on, in my opinion. And I think
Yeah.
that needs to change.
And what do you think, Mary? I mean, what do you think? Obviously, physicians do need to speak out. We always need to question, but on the patient side of things as well, you run an independent practice now, and you're very well supported by, the amazing patient cohort you have. They love you as a physician. How do you encourage other patients to, break off and be independent and find independent doctors?
Well, before I answer, I do want to mention something. I had asked Ron, what about your patients? Can they send letters in? Can they call? And he said he doesn't have access to any of those patient records anymore. So what was the name of the facility that you ran? Maybe we can, make a shout out to the patients, because there may be some that are watching, and that they could, call, and who should they call? And
That's a great point and a great idea. Thank you. It was First Call Medical Center in Anne Arundel County and Prince George's County in Maryland. They could reach out to Todd Blanche, Acting Attorney General Blanche, President Trump, Associate Attorney General Harmeet Dillon. I think those are the people that can really pull the trigger and make this thing disappear. So that's a great point, Mary. Thank you. Yeah, I mean, I lost access to all the EHR. I don't have any. I can't get into the records. I can't see anything anymore. The whole business is basically gone. So that's a great idea. If people are listening, please, if we saved your life, if we treated you, if we were there for you, please be there for me. I mean, I don't know how else to ask that, but I think that's a great point.
What was the name of it again? First Call?
First Call Medical Center.
And where exactly is it, or
In
was it?
It was in Anne Arundel County. We had multiple sites throughout Anne Arundel County, actually Anne Arundel County, Prince George's County, and Calvert County.
Well, and even if, there are people out there that you didn't treat personally, if you got monoclonal antibodies and I mean, and had a great experience, we should all support what you did because it was the most effective treatment we had. I can tell you that hands down. And the government took it away. One thing we haven't mentioned is the timing of that. It actually coincided with Biden mandating the COVID shots. This was the fall of 2021, the
Yep.
third and largest surge of the pandemic. This is following the rollout of the magical COVID shot that was going to make it all go away, which obviously didn't work. And in September 9th, 2021, Biden mandated the COVID shots and at the same time took away the monoclonal antibodies. The timing, it all lines up.
Absolutely. And to your point, Mary, and Ryan, I don't know if you know this, but I've been on Mary's show twice and we've talked about this.
I've watched both actually.
Oh, okay. So there's a little known federal law that Secretary Kennedy talks about. And apparently when there's an emergency authorization in the EUA for a vaccine, if there's anything that's proven to be efficacious against that illness that the vaccine is for, the EUA is lost. It's taken
Mhm.
away.
Mhm.
So that's why they had to beat down ivermectin. That's why they had to beat down hydroxychloroquine. But I would argue that the monoclonal antibodies were way more efficacious than either of those two medicines. And it's a one and done thing. You get one time 30-minute infusion and you're done and you're cured. So, but to Mary's point, I spoke out in December 2021. The next couple months, each of those monoclonal antibodies that were available very quickly were taken off the market. And now you cannot get them anymore. They're not
And
available.
I remember one of the excuses they used is, oh, well, the monoclonals aren't matching the variant now, so we're going to pull them. Well, if that was true, then they should have pulled the shot at the very same time because that lock and
Correct.
key mechanism of a protein and an antibody, if they said the monoclonals were matching, that meant the shot was expired as well. And
Well,
they,
And this is the same people who said that it was a 70% prevalence when it was really a 20% prevalence. So,
right.
they're completely full of crap, excuse my language, but
Yeah.
and they kept changing the monoclonal antibody with the strain,
Yeah.
actually. And then all of
correct.
a sudden they couldn't do that anymore.
Right. Yeah.
It made no
Magically, their
sense.
ability, they forgot how to land on the moon, I guess. I don't know.
Right.
But
Yeah.
and yours is such an important case and so instructive in terms of not only the bad science, the bad policy, the public health disaster, the targeting. I mean, if people look at this panel tonight, I'm Stanford, Hopkins, Mayo Clinic. uh, we're not a bunch of fly-by-night physicians. I mean, credentialed physicians who simply wanted to tell the truth, save lives, and get a public through this window of time quickly so that people could live, survive, thrive. And yet the system targeted those who had a voice of experience and authority. And obviously they've tried to take it away, and that they're still hanging on to the lies that they perpetuated these many years later and putting everybody and their families through what you guys have all gone through. It's still just beyond my comprehension at this point. So, it's very instructive to the audience to be vigilant, be aware, be supportive, be vocal, and, just be a part of the solution.
And question everything.
Absolutely. And I think,
Question everything.
that's such a great point, Dr. Elfenbein. The trust in medicine obviously has gone to an all-time low for very obvious reasons. But to question everything is just part of being a good doctor, good scientist, good human. And How can people support you or bring attention to this case? Obviously, we've talked a little bit about that, and I'm glad, Mary, that you brought that up about the center and anybody who successfully was treated by Dr. Elfenbein's clinics. Ironically, I lived in Prince George's when I was a kid for a couple of years, so
Oh, really? Where? That's so funny.
Upper Marlboro area.
Oh,
So
yeah.
yeah, so I was there a couple of years of elementary school, a long time ago. But so when you brought that up, I'm like, hey, that's my old stomping grounds. Catching toads and frogs in the backwoods and riding the
Yeah.
trails, and yeah, kind of a fun memory there. But yeah, how can what are other ways, and towards the end of the show we'll put up where they can follow you and support you as well. But what would you like to see happen in terms of the public helping out here?
Well, thank you for asking. I have a website. It's dropthecase.com. So people can go there. They can follow me. They can reach out to me. There's a give, send, go on there if people feel like they can. I really appreciate it because this nearly bankrupted me. If not for my wife having a job, we would have lost our home and everything else. So like it was crushing, and it still is. I mean, my lawyers have been great, but I will be paying them until I'm dead. So if people have the ability to donate, I'd appreciate that. You can follow me on X. It's Ron Elfenbein, MD, RonElfenbein. And if people can reach out to repost this, like you said, Ryan, like, just reach out to friends, tell the story, like, please just repost things. Social media is really powerful. And it got a lot of people elected to office. It got a lot of people thrown out of office. I mean, it's a very powerful thing when leveraged correctly. So people can please just use the power of social media and then reach out to the president, reach out to Todd Blanche, reach out to Harmeet Dillon. Look, the more phone calls, the more emails, the more letters. If you have time and you have the inclination, please do a handwritten letter to him or to her. Any of those people, that kind of stuff goes a really, really long way because most people don't do that. So if someone's willing to take the time to write a letter and then make a phone call, whatever, that would be huge. So I'd really appreciate that.
Wonderful.
Um, and you never know who's watching. You never know who's watching and
Exactly.
paying attention.
Exactly. Hey, Mary, I know you've interviewed Dr. Elfenbein a couple times, as you mentioned. What have I left out? What are some things that you guys have covered that you think I should highlight here, or we should highlight as a team?
Yeah, I'm actually surprised we're here tonight because I just assumed, it's a lot like Kirk Moore's case, who there was a very happy ending. So I'm hopeful that I just can't believe I have reached out to everybody I know that I can think of, but I will do it again. I hope that people out there who have a podcast that you will interview Dr. Elfenbein, and because we just have to keep the public pressure on. That's what worked with Dr. Moore. It's unbelievable that this is still going on. I'm just at a loss for words.
Yeah.
And
And
it's, oh, sorry, go ahead.
go ahead. No, go ahead, Ron.
I was going to say, it's funny because for the longest time, for like 3 years, my lawyer says, don't talk to anybody, don't say a word, just be the good defendant and don't say a word. And that's kind of what they bank on. But I finally made the decision because I talked to Kirk Moore. I cold called him after he got his case dismissed. I saw the thing come up on the news, and I said, I got to find this guy. So I Googled him and I called him and I said, hi, and he was so gracious and magnanimous, and he talked to me for a while, and he was just wonderful. And he said, what made it work was exactly like you said, Mary. I went public and I made a big stink. And I
Yeah,
said to my lawyers, I'm going to do exactly what this guy just did. And I thought they were going to be very hesitant, but they said, you know what? You already had a criminal trial. You already testified. What are you going to say that you haven't already said?
Mhm.
right.
And it's been so cathartic to do this because like this is just so ridiculously silly and nonsensical. But if you read the Department of Justice's press releases, it's like completely opposite explanation. You're like, oh, this guy's the worst person on earth. He stole all this money. He did all this horrible things. A completely 180 of what the truth is. And so it's great to be able to tell your side of the story. And I would encourage other people out there who may be going through similar situations to say something. And I learned a lot during this. I learned that like you watch the news and you read something and you hear, oh, this person was indicted for this or that, and you immediately think, oh, well, they must be guilty. And I've really learned to say, you know what? We got to let the facts come out because having gone through this, I know for a fact that like maybe they're innocent and maybe this is just government overreach, and we should be careful about jumping to conclusions.
Well, and even the money machine behind the media that, all of us have gone through allegations, through the media, and they're funded, 70% plus by pharma. They have an agenda in terms of trying to paint people as villains that are not, just to bring headlines. And then they write egregious things about you that aren't true. So I do think that's important where we fight back, use our voice, tell the truth. And at the end of the day, again, I hope your case goes away. I think common sense would dictate it has to go away. But that's where we're all just continuing to tell our stories. And I think Mary's right too. Just
And
you can,
one thing that we have to realize too is there's this big anti-fraud push going on right now. So now you're fighting that too, because
Yeah.
everything that suggests fraud is now automatically fraud. And so you've got an even bigger hurdle, at least in the media and the public eye. So I hope everybody will realize that it's one more reason to push this out and get the truth out there on Dr. Elfenbein's behalf.
yeah, absolutely. And
Thank you.
we need to remember we have a justice system where you're actually innocent until proven guilty, and the judge acquitted him. I mean, he's innocent. And see, that's what's really, I think, again, I think they're trying to make examples of strong voices, and that's not the way that our society should function. All voices need to be heard, and at the end of the day, quit trying to silence our First Amendment right to speak. And that's, I'm grateful that you finally did just say, I'm just going to start speaking out. I need to, tell my story. And because of that, it is gaining traction, and we will continue to amplify your voice and continue to get it to as many ears as will listen.
And it is vindictive and selective prosecution. I mean, I don't think
No
there's any
doubt.
question about that, based on exercising my First Amendment rights. And what's crazy about that is, to Mary's point, there's all this fraud out there that miraculously, just because a 22-year-old kid decided to go to Milwaukee and find the Leering Center, and literally, I think he's 22 or 23, and he's the one that uncovered it all. And now all of a sudden, it's the thing that you're hearing about. But the Biden administration was there for 4 years, and they didn't do anything about this. Instead of fighting the real fraud, they came after me,
Yeah, I mean,
silence me. I mean,
billions
that's just mind-boggling.
billions of dollars are disappearing through phony front businesses that never did a thing or never helped anyone. And over 250 bucks, they're trying to put you in prison for 50 years. I think,
Yeah.
when somebody hears that, it yeah, just pales in comparison to the real fraud that is out there that we need to stop. And I think, we have a very engaged audience. Mary has an engaged audience. I thought I had an engaged audience, but my reach, I think many of us are throttled on some of the socials at times, but it is what it is. But at the same time, I mean, I know we have international listeners as well, and they're under systems that are a little more, many of them are more draconian than what we've experienced. And so I think this is a lesson to humanity that we've got to stand up for individual freedoms and rights, and the ability to disagree, and the ability to do what's right for humanity, not for the big giant corporate systems
It's a great
or
point. I just got
governments.
interviewed by a lady
Now,
in Spain
mhm,
because of exactly what you just said, because this is a global issue,
it is.
unfortunately.
It really is. Well, on my screen, Kelly's popped into the corner, and I know we probably have quite a few audience questions. So, Kelly, I will be quiet and let you take over with some of those audience questions for Dr.
Great,
Elfenbein and Mary.
a great discussion tonight. Just a point of clarification. So for Dr. Elfenbein, Jennifer asked, I missed something. I thought that you were acquitted after the judge in the ongoing case. And the other point was, why didn't
I
the
was.
judge dismiss the charges with prejudice and prevent a retrial? Could you explain those 2 points?
Yeah, so I was acquitted by the judge.
Okay.
He overturned the jury verdict, which is actually more. Look, the jury can find you innocent or guilty for a myriad of reasons. Doesn't mean you're guilty or innocent truly.
Mhm.
But when the judge does it, he's saying there wasn't any evidence. So it's more profound actually than just the jury voting one way or the other. Um, he couldn't dismiss with prejudice because I guess that's just not something he can do. I don't know. I'm not a lawyer, but he acquitted me of all charges and said you are innocent, but the government was free to, it should be double jeopardy. I don't understand how it's not, but apparently it's not. Again, I'm not a legal scholar, but that's what I was told. And I mean, this whole thing doesn't make any sense to me. So it's just one more
Mhm.
kind of crazy thing that
Yeah, that
this whole
does seem
mix.
like double jeopardy, doesn't it?
Right.
Yeah.
And some people, a lot of people in the chat have made a lot of great suggestions on who to contact and who to support. And I know you mentioned to us, even when we were on before we started the webinar, that actually, some people in powerful places have actually reached out and contacted you. So there is some encouraging support. We certainly want to kind of drive momentum, and this audience can help do that. But people are asking if anyone from HHS or any of the other, senators have reached out to you or are willing to support you.
Well, I have had a United States senator reach out to me, cold called me actually, saw me
Mhm.
on actually Dr. Mary's
Mhm.
podcast. And then I had somebody from HHS reach out to me.
Good.
And I would argue, so I was actually technically a subcontractor for HHS, and I went on national news and I complained about the fact that they were killing people. I would argue that makes me a whistleblower. So
Right.
I would argue that I'm kind of should be covered under the whistleblower statute, and I should be afforded some protection. And in fact, when the president took over his first day, he issued a memorandum saying we're ending the weaponization of government. And one of the things that they were looking for were cases exactly like mine involving whistleblowers. So I would say like
Mhm.
this is a perfect case. Like this is great. Like bring my case forward. But they don't have a website. They don't have a phone number. You can't just pick up the phone and call Donald Trump. So it's hard to get in touch with the right person. But yeah, I have had people call me. People in the Department of Justice have called me. Um, so I think I'm on the right track, but it's just finding that right person. It's just the one guy who can. It's like when you call the insurance company, you got to find the one person that can actually answer your question. And I think that that's just what I need to do is find that
Well,
one
there's
person.
so much great activity in the chat going on that our team's trying to respond to, and we've been posting the ways to follow you. And again, for anyone that's not watching live tonight, we will post this on our website and our social media channels. So the video itself is a great thing to share, as well, just so we can amplify it. And we'll see what we can do, Ron, too, and just on clips and those kinds of things that can get passed around and share it with our fellowship and our followers.
Yeah, thank you.
So Ryan, a couple of people said you alluded to like something had happened to you as well, but I don't think everyone knows the full story and where you're at with your defense of your medical license. Maybe just real quickly to
Yeah.
talk about what's happened and where you're at.
Yeah, real fast. The CEO of the local hospital system, he filed I was licensed in about a dozen states at the time during COVID. And similar to Dr. Elfenbein, we tested, 200,000 patients and was busy and involved just helping patients. I treated many patients, all of whom did well. And the hospital system CEO decided to file a complaint against me in every state where I was licensed for misdis, malinformation, all that jazz, College of American Pathology, American Board of Pathology, you name it. Wherever he could file a complaint against me, he did. And so, like Dr. Elfenbein, went through years of legal torment and hundreds of thousands of dollars. And thankfully, some fundraisers helped to a good degree. Still going through it, the medical commission in Washington was the only state at that point that decided, oh gosh, we'll do this. All the other states said, well, this is all based on a First Amendment issue, and they dropped it. And anyway, so mine recently, after the Colorado therapist hearing and the free speech issues there,
Mhm.
Washington approached and said, well, I think we may be willing to settle the case. And so we looked at their settlement offer, we countered, and they said, well, no, we guess we don't want to settle. So now we have a court date set for, well, interestingly, the appeals court said, well, the case isn't ripe for us, go back to Superior Court. We appeals court said you didn't provide any evidence against him. You got to go to Superior Court because your entire hearing didn't have any evidence against Dr. Cole. So I'm kind of in this legal limbo as well. Lost my career over it because the insurance company stopped paying me, like Dr. Elfenbein said. It isn't just the legal attacks, but all the other entities also look at you as a, scarlet letter, and it just. So anyway, I'm hopeful as well. with all the truth that's come out over the last several years. And, to Dr. Elfenbein's point, we're just hoping common sense ears finally hear this and just drop cases. And Mary's gone through the same thing. So I'm not saying, oh, woe is me. I'm just saying it's just a process we're going through to tell the truth.
Well, and I guess one thing is we should say thank you to all the people that are on tonight and the many people that follow us, because many of you have helped Dr. Cole and
Yes.
Dr. Bowden, directly in defense of their legal case. So we really appreciate this is a group that cares about the doctors that stand out and tell the truth. So thank you all for helping.
Yeah, we're all beyond grateful. Thank you.
Yeah. And I know, oh, go ahead,
Can I
Ron.
just say, I'm sorry,
You
I'm sorry.
bet.
I just
You
want to
bet.
say, Dr. Cole just said something that was they brought a case with no evidence. Like that should scare the crap out of everybody listening to this, right? And it went to court, and you ruined your life, you ruined my life. No evidence. Like you think that they must have something on people when they bring this kind of stuff, but they don't have to, and that is just insane. And I'm sorry, I just really had to make that point because it is such a powerful point that they literally don't have any evidence, and it doesn't make a difference.
But look at all the harm that it can cost
Look at all
and
the
the
harm.
ruin of your
Right.
career and your family and all the things that have been discussed tonight. One question that Laura brought up was, what do you all think here about the recent Supreme Court ruling where the ninth district decision to stand that governments can mandate vaccines, even if they don't have proof the vaccines are either safe or effective?
Yeah, they didn't rule that. They just, well, the Ninth District did, and SCOTUS refused to listen to the case, unfortunately. I think
Right.
this is a disaster for humanity. And I think we're going to have to try to continue to bring similar cases. And it's basically saying any government, and it doesn't matter whether a product works, doesn't work. If the government says you have to take it, they have the right to do that. That no longer makes us a constitutional republic. That's my opinion.
100%.
You know,
100%.
Ed?
I mean, and it's scary and it's terrible. And each state now should pass its own law that says in direct opposition to that ruling by the Ninth Circuit, because it's insane, absolutely insane. I don't know anybody who reads the United States Constitution, which by the way is very easy to read, can come up that that's constitutional. I mean, I just boggles my mind.
I know that we're very active with a, Medical Freedom Act Coalition just to help push back against any kind of mandates, medical mandates, as well as an organization and 12 other great organizations too. So something we'll definitely want to keep on top of as an organization and all of our followers. Well, before we, cut, I want to do a couple things. One, I wanted to, if we could go ahead and pull up Dr. Elfenbein's slide, Autumn. I wanted to go ahead and show people, we've been posting as well, but how people can help and support you on your legal defense. And we've made sure to post your website and your Substack and your social media following too. So any closing comments you'd like to make before we head off?
Just thank you so much for having me and for letting me tell my story, and for everybody's sympathy and just being here and listening. And but if again, this is bigger than just me. This is really truly bigger than just one person and one family. And this kind of stuff, as I said, is just so un-American and so antithetical to what we all stand for and science in general. And I think so if you can tell somebody, talk to somebody, follow me, write a letter, whatever, give some money, whatever you can do, please. It's very much appreciated. And this kind of stuff just can't be allowed to stand. So
And we
thank
know
you.
that this kind of injustice, I mean, it silences so many other healthcare providers that won't speak up as a result because they're scared of the retribution that will come to them.
And I would just add, everybody out there, stand with the good ones. Dr. Elfenbein, Dr. Bowden, they're the good ones. And there's so many out there that are, and just don't be afraid to use your voice.
Okay, and Mary, I wanted to, did you want to
Well, I
say
was just
anything,
gonna say,
Mary,
I just want to
before?
remind everybody that Dr. Elfenbein is facing 50 years in prison. This
Mhm.
is not,
Yeah.
I'm going through a big
Serious.
fight with the medical board, but this is not, I mean, that's nothing compared to, I can't even imagine 50 years in prison for a billing dispute. So we really, really need to push hard to get this message out.
Well, and I want to mention this, for everyone. We had our attorneys look at everything, and I was probably slower in responding to Dr. Elfenbein because I wanted to make sure that we truly vetted as an organization his case. And he said there's bylaws that they should have followed, that if there were questions about billing, you don't just jump to an indictment. You actually contact that person, you write a letter and you make a question. So, Ron, you brought this up earlier. So just any of the typical rules and normal cadence of what would have happened was not followed here. So all that starts to add up to that this truly was an attack, and lawfare on you for speaking out.
Yeah, I mean, none of it makes sense when you look at it on the factual grounds. None of it does. So
Mhm.
there has to be an alternative motive. And the only alternative motive I can think of is that they wanted to shut me up and I was
Right.
speaking out and I was putting the vaccine at risk, the EUA. So because we were the largest supplier, not just in Maryland, I believe in the entire mid-Atlantic region, Delaware, Pennsylvania, Virginia, West Virginia, Maryland, all these states that, and I think we were the largest, bigger than Hopkins, University of Maryland. We were just I was giving this stuff to anybody who qualified and everybody. I just it was great. And I think
Mary, I
that,
know you were very
you know,
active with your patient base on the monoclonal antibodies too, and you felt like it saved a lot of your patients, during the crisis in
Right. And
Houston.
like Dr., people were rationing it. So they were
Mhm.
rationing it by race. They were
Mhm.
rationing it by age and comorbidities. And I didn't never do that, which made
Mhm.
me very busy. But,
Mhm.
and sounds like you were the same way, Ron. You didn't ration it based on race. And yeah, but that was definitely not what the government wanted.
again, that it's
Well,
just so unconscionable and so evil. It's just evil. Like
it
what they
is
did was
evil.
just evil. This is the best word to describe it.
Well, and I think that's why we have to continue to tell the stories so that people don't forget. Which brings me to Mary, your book, which officially launched yesterday. But we were talking a little bit before we got on, but we've got dangerous misinformation. Tell us a little bit about your story in writing the book.
Yeah, so dangerous misinformation was my big crime. After I tweeted vaccine mandates are wrong, I tweeted that 25 times in one day with a patient testimonial. And I didn't have much of a following. I think I got a couple likes or something. But next thing I know, I've got a text message from a reporter at the Houston Chronicle saying, could you please verify that your privileges have been suspended based on comments you made on social media? And I did a double take. I'm like, I don't know what you're talking about. Go check your sources. That's crazy. And then I go to Twitter, and Houston Methodist is tweeting about me. And they said I was spreading dangerous misinformation that was harmful to the community, and they were suspending my privileges. And the next thing I know, I've got CNN, Washington Post, the NBC on
Mhm.
me. I've got people yelling at me from Australia. It was crazy. I mean, I had no media exposure, maybe a podcast here and there, but nothing like this. So it just lit my fire, and I've been fighting back ever since. And this book is the record. It's my tell-all. It's a learning experience. I hope I wrote it to be an easy read. You can read it in one day. It's not
Mhm.
really super long, and it's in a sort of conversational style. It's a great travel book. You can fit in your backpack very easily.
Well, where can people find it?
Well, of course, Amazon and
Amazon.
Barnes and Noble.
Barnes and Noble.
Barnes and Noble won't feature it in their store, so
Of
I don't know
course
if
they
you want
won't.
to buy it from them, but Amazon's probably the easiest.
One thing, I mean, I think it's great that we can, I know a lot of our people want to support you as well. And it's like, will be a great read. One thing that you said, before we started filming tonight is that this whole experience to you, helped give you some purpose, in addition to what you're already doing, that should give you purpose as a physician. You want to speak to that a bit?
Well, yeah, it was very difficult at times.
Mhm.
And, at times I felt very sorry for myself. But in retrospect, it was the best thing that ever happened. So, nothing worthwhile is easy, as they say. And I'm confident that Ron Ethelbein, there's a light at the end of the tunnel for you, and that this will prompt you to become an activist and help other people. And yeah, that's what I'm trying to do now, trying to get other people's message out there, pay it forward, because a lot of people helped me. They gave me media exposure when I needed it, and I found that very helpful. But I know, and I can't really claim that I would have chosen this. I kind of got thrust into it. But if you do get thrust into it, I would encourage you to fight very hard.
Yeah, I heard a great line from I have all six daughters home for their youngest sister's graduation tomorrow night. And my fifth daughter, she said, you know, Dad, sometimes rejection equals redirection.
Hmm.
And I loved that because it kind of speaks to your fight in your heart, Mary, and Dr. Elfenbein's heart. You know, I think when we go through things like this, it redirects us sometimes into even greater things.
All righty. Well, I have
I-
like one final question for you, Mary. A lot has been on social media, and I know I talked to Dr. Varone about this too, about the new plasmapheresis stem cell work that's happening for those that are vaccine injured. People are asking if you can speculate on what you think the timing of this in terms of coming to the US. I know Dr. Varone has talked about evaluating this as well, even in his clinic.
Yeah, it's a little bit muddy right now because
Mhm.
there's been some roadblocks, of course. It's a question of can we legally bring it to the United States? And I'm not even sure where that stands right now,
Mhm.
but we are still trying. And I think at this point, they've done about 21, 22 patients,
Mhm.
and everybody's had a good outcome. We don't know if it's going to be a good long-term
Long term,
outcome yet.
right?
But it seems to be significantly better than anything else that we have at this point. So it does hold promise.
That's great. I know it's something that we definitely want to track, and you work closely with Dr. Varone as well, and he was bringing up his interest in researching that as well. So we'll continue to track and try to provide, updates as well. Well, before we wrap and I get into just some closing, anything you all would like to leave the audience with tonight before we close?
I just want to say thank you to both of you and to you as well, Kelly, and the team. But this is such an important lesson for all of us. And Dr. Elfenbein's case is such a prominent example of why we need to stand for freedom and liberty and stand up for those who have done good things that are being
Mhm.
persecuted maliciously. And we need to fight against that. So thank you.
Anything
Yeah,
else, Ron?
thank you all for having me. And Kelly, it's been great. You know, we've talked on the phone a number of times,
Yes.
and you've just been so supportive and wonderful, and I really appreciate it. And to Dr. Cole's point, like, again, I'm not the only person that's going through this. There are other doctors. Like,
Mhm.
comes to mind right now is a friend of mine, Sanjeev Kumar. He's an OBGYN who's being railroaded, very not quite for the same reasons, but it's similar story. So there are other doctors out there who this is happening to, and we just cannot allow this kind of stuff to go on. And I will say, like, to Mary's point, um, you know, I God works in mysterious ways, and I would never wish this upon anybody. But I have made some wonderful friends. I have met people I never would have otherwise had the opportunity to meet, and they're wonderful. And that's some of the most wonderful people in my entire life going through this process. So I'm very thankful for that. And I'm very thankful for all of you. So thank you all very, very much.
Well, we'll continue to push for a good outcome for you and make sure that we keep everyone updated and share as much as we can for everybody to kind of help on your mission here. So thank you all for tonight. I appreciate it. Important story to
Thank
tell.
thank
Alrighty,
you.
well, one thing I wanted to talk about as we get into our closing announcements is our trusted referral network. It feels like it's really critical right now, where so many people are not able to find a doctor that they can trust. We have so many that are on our webcast and shows, and as we continue to build out this network, we're in the process of moving our legacy directory over to this new environment with a great new user interface and a lot more search capabilities, and provides it across many more different kinds of specialties than just COVID and long COVID and COVID directly. So anyone that's professional on tonight, we'd encourage you to check it out and see if you're willing to join at network.imahealth.org. And as we get the full legacy network, pushed over here and get a critical mass, and we'll more formally launch it to others as well. And even folks that are patients here, if you know a well-meaning doctor that you think would be interested and worthy of being on this, share this link as well. So that's an important thing that we're doing with the Alliance, and like to grow that as much as we can to be an indispensable resource. The next item is our Parents First campaign. We are so stinking close to our goal. We have until the 23rd to hit our goal, so we're at 88% there. So anything you all can do to help support the great organization, every dollar that you give us, in the next couple of days actually is doubled for us as an organization. And we're using this to build out a lot of the great work that we've done under parent education with our different bench of pediatrics so that we can provide the informed consent that is not happening today, especially with all of the infighting between the American Association of Pediatrics and the CDC and all the powers at play. So right now that's harming parents most of all because they're not getting good advice. And then another new content guide that we've got coming out is Amino Acids 101. It's a guide on what they do and why they matter. You can go ahead and follow the link here, genie.us/amino-acids-101. And you can get, all this is made free as a result of the great donor support that we get. So check it out and you can scan the QR code on screen as well. And then we've got a lot of questions. We're actually, next week, we actually are going to have 3 of our experts on to talk about the things we've been seeing on social media beyond the bite, understanding ticks and the alpha-gal syndrome. So Dr. Hull will host Dr. Kat Lindley and Lynn Finn, and we'll talk about those issues next week. And then as we go to our close right now, tonight's conversation has really been about courage. And one of the videos that we created with one of our senior fellows, Dr. Jennifer Hibbard, she talks about the importance of standing up and educating the young physicians that are coming out of school and making sure that they're standing up for integrity and evidence and many of the values that we have at IMA. So I'll go ahead and we will end with that. Thank you all for joining tonight.
Hi, everyone. I'm Dr. Jennifer Hibbard. I'm a Senior Fellow of the Independent Medical Alliance, and I wrote a paper I'd like to share with you briefly, and it's published this month in the Journal of Independent Medicine. I wrote a paper because of just a passionate reaction to what's going on in our healthcare education system. I am a practicing pediatric dental surgeon. I also teach in the faculty at the University of Toronto, and I am chief of the dental services in a big hospital health center in Toronto. So I'm involved in all these levels and also run clinical practice because I'm trying to make contact with people on every level. And what I saw when I was teaching at the university and at the hospital made me need to write this paper. At the university, I was finding that the students are, as we all know, it's going much more towards simulated care, simulated education. Everything is online now, and AI is a big part of their education. I was shocked to see how much it has shifted in 1 year. The graduating students were not seeing patients as they usually do. A lot of them were working on mannequins, which is simulated treatment. I also found it very troublesome when I looked at the entrance requirements for a lot of universities now, especially across Canada. I'm located in Toronto, Canada, and they have different streams of entry. They have entry for EDI, equity, diversity, and inclusion. These streams of entry in one of the universities in Toronto and in a few other universities don't even require MCAT entry exams. It doesn't look at any science prerequisites, and it's based on real life experiences. And that's up for interpretation. I wrote this paper to call to action to all the mentors and all those who want to see our health system repaired. Patients go into the hospitals, go into healthcare centers, and they put their faith in the doctors and the nurses and the auxiliary healthcare workers to actually take care of them, and they trust them based on their education and background. And I see the level of education has greatly eroded, and it's a very important time right now to step up. Please go to the Journal of Independent Medicine at journalofindependentmedicine.org to read the full article and many other wonderful articles that are in this month's publication. Thank you.